It is the popular saying that an healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nancy Osun is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Happy Sunday to you all. It is another wonderful moment with me, Bola Olayode, on the program The Great Mind. On this episode of the program, the personality we are celebrating is Oba David Omisore, Odu of Olode. Meanwhile, on the S segment, we are focusing on the training organized by Osun Health Agency for WDC and OIC across the local government areas in the state. Osun Health Insurance Agency, an agency established through an enactment in Osun State, is purposefully created to be giving residents in the state access to qualitative health care free from financial hardship. Also, among the objectives of Osun Health Insurance Agency is ensuring that everyone who resides in the state has easy access to effective, quality and affordable healthcare services, and also protecting families from financial hardship of huge medical bills. It will be recalled that Osun Health Insurance Agency has embarked on the enrollment of the vulnerable people across the local government areas in the state in the past few weeks to ensure that less privileged in the society benefit maximally from the free healthcare services of the agency. Simultaneously, facility level training of stakeholders on the operation of the Health Insurance Gateway of Basic Healthcare Provision Fund is on across the local government areas in the state for the full implementation of the scheme. The participants are the training ward development chairmen and officers in charge of public health centers in the state. Mr. Bello Ademola is the monitoring and evaluation broker officer for Osun Health Insurance Agency.
We have MIE tools from the NHIS from Abuja. That is what we are using to train them. It's just a means of reporting their activities. We have the encounter register, which will be domiciled at the primary healthcare level and secondary care level as well. Then we have a summary sheet as well that will be used to summarize all the encounter reports they have in the facility on a monthly basis. So in summary, that's basically what we'll be taking them through. You know, BCPF is Basic Care Provision Fund. Their aims is to capture the poor and vulnerable in our society, the less privileged, the aged pregnant women and children under 5. They have a guideline, but the guideline has been reviewed since last year. So we are taking them through the new operational guideline. So that's the reason why we invited them for the training. For the optimal performance, what they need to know about the BACPF, then how to treat our enrollees when they come for service. That's exactly what we're treating them.
The stakeholders at the facility level training on the operation of the Health Insurance Gateway of Basic Healthcare Provision Fund have this to say.
The training is a very special one because we are expecting this. So it's on Basic Healthcare Provision Fund. Though we started the program more than 2 years ago, but there were some issues regarding assessing fund as well. But we are happy with the who is coming now to our rescue. So most of the issues are resolved. So in terms of funding the facility, though there are different layers of funding to facility, from the national, from the MPACDA to the state primary health care board, so also the OIS too. So most of the issues that we have, most of them are resolved based on this training.
The challenges before this, there are being a lot of clean funds that people are feeling before. the OIC are training before at the NTA level. Now, the claims all come as a grassroots. There's nothing like claims once again. It makes the work now easier for them. And there's some other challenges at the local government, at the health facility level, like maybe the patronage is not all that okay before. Now that there are a lot of drugs, there will be a lot of drugs, there will be a lot of things in the facility, it will increase our patronages. And people will feel the impact of the government more at the local government level.
The training was interesting. So to me, it was interesting because I know the importance of the basic health, the importance of the basic health. I know and under the police self, I know the importance of police on this particular training because we know that the people that have this thing is from pressure that is poor age, under 5 to under 5 age, the poor or the poorest, elderly like less than 85 years. That the people that will have opportunity on that to take the patient that may have opportunity to achieve the treatment free.
Àwọn ẹ̀kọ́ tá a rí kọ́ náà ní wípé láti wọ́n tawájú ló sì máa develop sókè báwọn àbáṣe torí WDC chairman ní èmi so láti mobilize àwọn èèyàn jáde pé program tó tún dé leléyìí o tó ti yàtọ̀ sí ti tẹ́lẹ̀ so àwọn ẹ̀kọ́ tá a rí kọ́ ó pọ̀ lọ jàǹtìrẹrẹ ká sì máa mú lọ.
lọ́wọ́ OIC fún ẹ̀kọ́ pàtàkì tí wọ́n á fún wa ní àárín láti jẹ́ kí gbogbo aráàlú tó lè mọ̀ nípa nǹkan tí ń ṣẹlẹ̀ lẹ́tọ̀ọ̀tọ̀ lọ́wọ́lọ́wọ́ a sọ pé gan fún ẹ̀kọ́ tí wọ́n fún wa torí pé gbogbo nǹkan tí wọ́n ṣàlàyé fún wa yìí ó fi hàn pé táwa tó délé àtọ̀lọ́ mọ́ra sí ohun tí ẹ̀kọ́ tá a kọ́ tẹ́lẹ̀tẹ́lẹ̀ torí ẹ̀kọ́ tá a kọ́ mi ti fi hàn pé ẹ̀kọ́ tí tó ti omi tó ti dé ẹja tuntun náà tó ti wọ ìbú kí Ọlọ́run ló máa rí kọ́ máa ràn wọ́n lọ́wọ́ a dúpẹ́ gan.
We don't know much about the OIS program particularly, but aside that yesterday, the way they teach us everything, I've known much about how to start the program now. So before, the OIS people, they have come to our center before to come and enroll some of our patients, like those indigent pregnant women, indigents under 5, poor of the poorest, those people that are less privileged in our community.
Dúpẹ́ lọ́wọ́ ìjọba ìpínlẹ̀ Ọ̀ṣun àti dúpẹ́ lọ́wọ́ àwọn OIS tí wọ́n gbé ètò yìí kalẹ̀ nítorí pé ètò pàtàkì ni fún ìlera àwọn ọmọ bíbí ìpínlẹ̀ Ọ̀ṣun àti àwọn àlejò tí bá ń gbé bẹ́ẹ̀ tó bá ti tẹ̀lé gbogbo àwọn ìlànà tí wọ́n kọ́ wa níbí. Ìdánilẹ́kọ̀ọ́ yẹn ṣe pàtàkì gidi ó jẹ́ kí àwa aráàlú WDC chairman kí á mọ̀ yìí pé a pàtàkì níbi program yìí fún ìlọsíwájú àti fún ìlera àwọn èèyàn wa fún ẹ̀kọ́ ètò ìlera adójútòfò tí wọ́n gbé kalẹ̀ yìí tí àwọn OIS gbé kalẹ̀ wọ́n sì jẹ́ kí á mọ̀ yìí pé àwa WDC a ní iṣẹ́ tí a gbọ́dọ̀ ṣe nítorí pẹ̀lú ìrànlọ́wọ́ wa la lè fi mú kí ètò yìí kí ó máa lọ ní bí ìjọba ṣe rò ó tí ó bá sí ọwọ́ ọ̀tún ọwọ́ òsì àti gbé yọ̀fẹ̀ nira díẹ̀ àwọn OIC wa wọ́n jọ ké sí wa sí ìpàdé mi àwọn gan náà ni púpọ̀ nínú iṣẹ́ láti ṣe nípa wípé àwọn ni wọ́n máa dá àwọn ènìyàn lóhùn àwọn tí wọ́n bá ti wá sí ọ̀dọ̀ wọn lóhùn ṣùgbọ́n ní kókó ni pé ètò yìí ó jẹ́ kí àwọn òṣìṣẹ́ ìjọba gangan àwọn doctors àwọn nurse ni kí wọ́n mọ̀ wípé àwọn gbọ́dọ̀ bá mójútó dáadáa pẹ̀lú akitiyan àwa WDC tába ti rí pẹ̀lú bí wọ́n ṣe kọ́ wa wọ́n jẹ́ ká mọ̀ yìí pé tába ti rí lapses a gbọ́dọ̀ jẹ́ kí ìjọba tètè mọ̀ káwọn òyìnbó tètè mọ̀ àwọn òyìnbó kọ́ a débi wípé gbogbo nǹkan tí a bá ti sọ ní àárín tó jẹ́ pé bóyá àwọn òṣìṣẹ́ ìjọba àwọn nọ́ọ̀sì ni wọ́n fẹ́ máa ṣe ntọ́bàtàkó tí wọ́n sọ alẹ́tọ̀ àti wá bá wọn ní ọ́fíìsì àwọn láti dórí pé ojútọ̀rẹ́ mi ojú òtì ní àìlójútì lọ́jẹ́ fún yàn ètò yìí èròǹgbà ìjọba lórí ẹ̀ ní pé ká kún àwọn lọ́wọ́ láti rí pé àṣàṣeyọrí lórí ẹ̀.
I will like to commend the #1 citizen of Osun State, Governor Isiaka Oyetola, because it's self-commendable. Where the essence of this program, it is very, very well and okay. And with the collaboration of OIS, which is Osun Health Insurance Services, it is make the program easier and meaningful. Being a WDC chairman, we were trained here to have a good cooperation with OIC.
From Olaskomi Sumonu is the Director of Programs for Osun Health Insurance Agency.
This training is trying to align a program of federal government with the state health insurance program. We call it Basic Healthcare Provision Fund Program, targeting the vulnerables in every local government, particularly every ward in Osun State. What you are saying here is they are representative of focal primary health centers in every ward of the state. We are organizing this training for them. The one we are doing here is for you, Osun West. We have started with Osun Central and Osun East. That was done in Michael Golf Hotel Ada. This is to familiarize them and turn the program to health insurance for the will-be beneficiaries that we have captured at the world level. By today, Osun Health Insurance Agency has captured over 62,000 vulnerables across all the wards in Osun State. And they will be issued an health insurance card that they will be using at the PAC in their ward. We are now training the officers, health officers of that wards across all the states on ways of implementing this program in the health insurance way. First of all, their benefits, yes, the benefits are unlimited. They will benefit from the program the way somebody who is under health insurance. Various surgeries, all other interventions are under this program. But we are familiarizing them with health insurance. The primary health care workers, we are training them on the implementation of BSPF, the health insurance way.
The Executive Secretary, Dr. Adeniyi Ogini, explains the basis of facility level training organized for the Ward Development Chairmen and officers in charge of public care centers across the local government areas in the state.
The basis of the training that we just, finished with, one of the several sets that we've been training since the last 2 weeks, is to intimate them, to educate them on the processes of implementing basic healthcare provision fund, especially the health insurance gateway of the basic healthcare provision fund in the local governments. Many of them have a wrong idea about how it should operate, beginning from how enrollment should be done, how we should document the claims, how we should document encounters, and all other governance processes that are involved in operating basic healthcare provision fund. And this confusion was actually set by the first manual. When this started in 2018, they had a manual. That manual was completely against the success of social health insurance schemes, because there's no how you can tell somebody to come and take something free and you are telling somebody to come and take the same thing at a particular cost. Nobody will want to take something that he can take free of charge at a particular cost. So we saw that there was a need for a review of that basic healthcare provision fund operational manual, and that review was achieved on the 6th of August 2020 when the National Council on Health approved the new manual. So based on that, we have to now educate the operators to know exactly what the new manual says and how it should operate in tandem with social health insurance, so that both basic healthcare provision fund and health insurance can grow in the state. And that is what we have come to do. So that everybody, the WDC, the officers in charge of the hospitals, the local health authority secretaries, they will know what they are supposed to do in the new manual.
As the certificates were presented to the participants at the training by the special advisor to the governor on Earth, Mr. Benga Oyibode, Ward Development Chairman and officers in charge of public health centers were full of gratitude to Governor Adegboyega Oyetola and Osun Health Insurance Agency. Meanwhile, as I said earlier, the personality we are celebrating on the program this week is Oba David Omisore, the Awolowo, who just celebrated his birthday. The Ayepeju Olode, which was founded 86 years ago and renamed Awolowo Town in 1980, was founded by Chief Lowa Ajani Anibijumo Omisore, the progenitor of the Omisore dynasty of Odmoya compound in Ile-Ife. The founding of the town was a reward for the patriotic initiative of Chief Lowa Ajani Anibijumo Omisore, who was Lowa Adimula of Ife between 1923 and 1941. After the reign of the Ooni Ademiloye Ajagun in 1910, there was no single motorable road in Ile-Ife and its environs. Since Lowa Ajani Anibijumo Omisore was a prominent and influential member of the Ooni of Ife's traditional council, he advised the Ooni to instruct all his traditional chiefs to request every compound in Ile-Ife to donate 12 able-bodied men for road construction projects through communal efforts. The advice was readily accepted by Ooni Ademiloye Ajagun. He, however, appointed Chief Omisore to supervise the projects, which culminated into the constructions of many roads in Ife Township and the districts. The remarkable success achieved in the road construction projects so much excited and satisfied Ooni Ademiloye Ajagun that he decided to allot the past land stretching right and left from River Aye in the north to River Aoron in the south to Chief Anibijumo Omisore in appreciation of his patriotic and developmental initiatives. Because this present Awolowo town, formerly known as Garage Olode, was a thick forest full of wild animals, professional hunters had to seek permission from Chief Lowa Omisore for game hunting. Game hunters later created a bushmeat market at the site to attract the patronage of traders and travelers. The place therefore became a road terminus where vehicles were being refueled and repaired. Oba David Olajide Omisore, the Olu of Awolowo town, who is also the father of Senator Ijiola Omisore, narrates in Yoruba language how Awolowo town was founded.
Ọba Àjàkú Adémilúyì ó bọ́ sórí ilé oyè ní 1910. Ṣùgbọ́n 1918 gangan ní Àjàkú ti fi gáràjì ọlọ́dẹ yìí fún bàbá tó bí èmi gangan, Chief Lọ́wà Àjàní Aníbìjú Omisore. Àtìgbáyé ní gáràjì ọlọ́dẹ ló ti wà. À ń pè ní gáràjì ọlọ́dẹ nítorí pé igbó dúdú ni, ẹ̀gàn ni, ẹranko sì pọ̀ nú ẹ̀. Àwọn kan wà tó ń pè ní ọdẹ, wọ́n wá ń ṣọdẹ ń bí. Gbogbo ẹran tí wọ́n bá pa ẹ̀bá títí ojú ọ̀nà báyìí ni wọ́n máa ń kó sí. Odò rẹ̀ ní orúkọ ìdílé láti lẹ̀ lọ. Ṣùgbọ́n tìtorí ẹran tí àwọn ọdẹ ń pa, tí wọ́n ń tà, tí àwọn tó rìnrìn àjò láti ibi Oǹdó ní lọ ní, tàbí àwọn tó ń lọ láti Ìbàdàn lọ sí Oǹdó tàbí Ọ̀rẹ́ tàbí bẹ́ẹ̀ lọ sí Bìíní, wọ́n máa ń dúró ń bí ra ẹran ìgbẹ́. Lóko aṣọ bíi pé mọ́tò bá ti ń lọ adúró ápáàkì, àwọn tí ó jẹ́ ìrònú ẹ̀ wọ́n á ní àǹfààní àti ìlera ohun tí wọ́n bá ń fẹ́ bí ẹran ìgbẹ́ nǹkan wọ̀nyí. Bí mọ́tò ti ń páàkì, lóko aṣọ di gáràjì àwọn wo àwọn tó ń ṣọdẹ, àpèpọ̀ rẹ̀ ló ń jẹ́ gáràjì ọlọ́dẹ.
Awolowo town is situated on a hill surrounded by a chain of other hills. The 1991 population census gave the town's figure as 560,000 people. The sons of Chief Lowa Ajani Anibiju, the founder of Awolowo town, have been ruling over the town as baales in quick succession. Chief David Olajide Omisore, who is just been elevated to a crowned king, became baale of Awolowo town in the year 2002. He was born in July 7, 1932 to Chief Lowa Ajani Anibiju Omisore. Maternally, Chief David Olajide Omisore belongs to Obalufe of Ife, Iremo Jawojo's compound. Oba David Olajide Omisore lost his father in 1941 when he was only 9 years old. The situation which made him to move to the house of late Chief Johnson Omishakin Omisore, from where he attended his elementary education. He attended St. Peter Primary School, Iremo Ile-Ife, in 1941 for Standard 1, and later proceeded to Central Primary School, Ilare Ile-Ife, for Standard 2 between 1949 and 1952. In anticipation of acquisition of better education, he proceeded to Odudua College, Ile-Ife, in 1952, where he obtained his ordinary level certificate in 1957.
èmi ò tẹ́ bìkítà fún skul wípé máa ń bá bàbá tó bí mi bàbá Omisore lọ sí ààfin ayé Àjàgùn máa ń bá a lọ sí ààfin ni tí bá sì dọ̀hún bó ṣe wù mọ́ ṣe yóò gbà mí bó ṣe wù mọ́ ṣe ṣe lọ́hùn nínú ìgbà tí bàbá wa kábíyèsí Àdìsá Adésọjí Adérẹ̀mí tó wà lórí oyè skul tó dálẹ̀ nínú ọgbà ilé ẹ̀ mo lọ bẹ̀rẹ̀ ṣùgbọ́n yóò jẹ́ kí n fojú sí ẹ̀kọ́ mo lọ sí skul yẹn ìgbà ayọ̀jù jẹ́ kí n fojú sí ẹ̀kọ́ ohun tí bàbá Omisore tó jáde láyé ní 1941 ní 1941 ní bàbá Omisore tó sùn nínú Olúwa ìgbà yẹn mo tó wá ń rí ìyípadà mo tiẹ̀ tó gbà pé mo lọ sílé ìwé lórí ìgbà tí bàbá Omisore tó sípò padà ló fi ní fún bàbá Johnson Omisore tó kọ́ 3 stories rẹ̀ mọ́ yẹn ọ̀dọ̀ ẹ̀ mo á gbé dàgbà nípasẹ̀ ọ̀dọ̀ ẹ̀ mo á bá lọ sí skul rẹ̀ mọ́ yẹn St. Peter's School àti bẹ́ẹ̀ mo ti wá lọ sí Central School mo á bọ́ sí Odùduwà College mo sì kà wọn bá tí mo máa kà mo kúrò ní 1957 lágbà mo wà kékeré tí wọ́n bá ní ìdánwò di ọ̀la ní skul tí wọ́n bá ní ìdánwò wa ó di ọ̀la subject bá lẹ́sìn máa kọ́ la máa ṣe ọjọ́ ọlọ́ àti ènìyàn kílẹ̀ tó mọ́ nǹkan máa fi question hàn mí.
May God continue to prosper the reign of Oba David Omisore. On that note, we are ending this week's edition of the program. Next Sunday is another date. God willing, then stay blessed.